we're going to be talking about vancomycin-resistant enterococcus. The most common cases of vancomycin resistance in enterococcus are shown in Enterococcus faecium and Enterococcus faecalis. The most common cases, which we're going to be focusing on, are seen in Enterococcus faecium. Hospital-acquired cases are most common in the United States, but community-acquired cases are also seen less frequently in the United States, but those cases are more commonly seen in places in European Union. And we'll be talking about how we would address such cases if they arise in the United States. Hospital-acquired cases, typically you would see patient transfer through hospital staff or other patients or visitors who come into contact with patients who are receiving vancomycin, or just around the hospital where it has been transferred, and they're not washing their hands before coming into contact with these other patients. And in non-hospital acquired cases, you might see it in contact with food, such as raw meat, or in cases like in Europe, they had found that it was in the wastewater, and this can be transferred through poor sanitation. It's usually not harmful, but in cases where it's transmitted into UTIs, such in hospitals, is common, where it would be transferred through patients who have a catheter, or also in wounds, such as surgical wounds, and if it makes it into the bloodstream, and they can be difficult to treat. The most vulnerable populations are immunocompromised patients, or patients who don't have the strongest immune system, such as children and elderly. So what we see here is a chart that shows the distribution of countries where beef and veal production, meat consumption, is the highest. And that's a growing concern because of a lot of that industry is using antibiotics in non-therapeutic methods to administering those antibiotics to the livestock. And when they're doing a subtherapeutic methods, what we're talking about is using it to promote growth. And this is a popular method with some within the industry, which more growth means more meat production, which means more money. So it's a very popular thing, and it's a growing trend, but we are seeing some shift in that, especially when you look at some countries in the European Union, as cases of non-hospital acquired vancomycin resistance has come up. Those cases have dropped due to the linkage to antibiotic subtherapeutic treatment of their animals. So in this map, we can see the distribution of where we're seeing the most of the resistant isolates that have been recovered. And of course, as we saw in the previous distribution chart, the U.S. is one of the highest in treating animals with antibiotics, and we're also one of the largest users of antibiotics on patients, and many times unnecessarily. So what we're going to look at it is just an example of how the antibiotic resistance can be linked to countries that were shown on that chart that show the usage or the consumption of meat products. And we see that in the country that ranked one of the lowest, in India, you see far less resistance to vancomycin in those isolates for Enterococcus faecium. This one falls below the 25% line. There has been some increase, but then there was a decrease in that. And that could be from therapeutic use in the healthcare setting. There's also plenty of places in India where healthcare is not not available, so there may not be as much usage in the healthcare setting there. So in the U.S., we actually see that since 1999, it's stayed relatively stable, but we have seen it go from below 75% to over 80% in some places. But it's stayed right around that 75% line, and it's to be expected that the U.S. being one of the largest users of antibiotics for therapeutic and non-therapeutic uses, that we would see a larger trend in antibiotic resistance. In the United Kingdom, we see that there was in 2005 one of the highest numbers, about 33% of isolates recovered were showing vancomycin resistance, and as a result, there have been some shifts in the European Union countries to mitigate that. Many livestock industries have discontinued the use of antibiotics for non-therapeutic uses, and they've seen a drop in many cases of the vancomycin-resistant strains. So how will we handle possible emergence of vancomycin-resistant Enterococcus as a epidemiological issue? Well, first we want to verify the laboratory identification, verify that is actually what we're dealing with. When we're dealing with infections from bacteria, we want to make sure that the growth we're seeing and the resistance that we're seeing is truly there. So once we verify that, we want to obtain the patient data and see if we can get some real data from those patients to find out where they acquired this infection from. We want to interview those community members who had the recent vancomycin-resistant Enterococcus infections, and we want to determine the source. We want to know whether it was hospital or community acquired. So you want to be able to rule out one or the other. In this case, we're interested in community acquired because we already know about hospital acquired. We already know that that's more common, and we kind of know how to handle that. But the community acquired is a little bit more difficult to pinpoint where that came from. So we want to determine the cause. Once we determine that, we want to know whether it was from food consumption, whether it was from raw meat handling, hand washing, whether it came from a water source. And you have to rule out whether they were acquired from hospitals. Make sure that they hadn't been to a hospital at a time when a infection could have occurred. make sure that they're not hospital workers, make sure they haven't taken antibiotics and that they've discontinued them long enough to where it won't give you confounding results.